Hello and welcome to EUFOREA TV Breaking News. My name is Dr. David Bull, I'm a medical journalist, and once again I'm delighted to be here as your host for this, our second show of July 2021. Now this show builds on our knowledge of GINA 2021. This was the much celebrated 2021 update of the global strategy for asthma management and prevention. In a minute, I'll be talking to Professor Mona Al-Ahmad, who is Senior Consultant Allergist and Clinical Immunologist at Al-Rashed Allergy Centre in Kuwait City in Kuwait. She's also Professor of Clinical Immunology in the Faculty of Medicine in Kuwait University. Now, last month we dedicated a show to GINA 2021, the 2021 update of the global strategy for asthma management and prevention. And as you may remember, it incorporates new scientific information about asthma based on a review of recent scientific literature by an international panel of experts on the GINA Science Committee. And you may also remember in that show I spoke to Professor Arzu Yorganzioglu from Celal Beyer University School of Medicine in Manisa in Turkey. And I also spoke to Professor Eric Bateman from the University of Cape Town in South Africa about GINA 2021. And I have to say the response was amazing. We had a tremendous response to that show with thousands of people watching. So in this episode, we want to spend a little more time looking at GINA 2021 from a Middle Eastern perspective and delve into some of its detail. Well, to help me out in this task, I'm delighted to be joined from Kuwait by Professor Mona Al-Ahmad. As I mentioned, she is Senior Consultant Allergist and Clinical Immunologist at Al-Rashed Allergy Centre in Kuwait City and Head of the Immunology Unit. And her research interests include allergic respiratory diseases and severe asthma phenotypes. She's lead author and principal investigator of many regionally and internationally funded research projects, and in my opinion has definitely put Kuwait on the global medical map. It is really good to see you, Mona. Thank you for joining me.
Thank you, Dr. Paul. It's really a pleasure to be on EUFOREA TV.
So let me start by asking you, what do you consider the biggest strengths and the progresses made in GINA 2021?
Now, it's an excellent question. You know that GINA is a global-based strategy for managing asthma. And asthma is one of the most common chronic lung disease worldwide. Now, I really consider GINA did, exceptionally well in terms of the 2021 update. The practical-based approach for clinicians that was based on the scientific evidence highlighting the importance of incorporating inhaled corticosteroids plus a controller, that is the bronchodilator, into a main concept. As you might be aware, the now treatment figure is highlighting the two tracks among the new GINA 2021. Track 1 is really emphasizing the inhaled corticosteroids as a reliever plus a controller, bronchodilator, preferably a long-acting bronchodilator or formoterol. And this has been really associated with risk reduction in terms of the exacerbations compared to using the short or the traditionally short-acting bronchodilator. We also know that the morbidity and mortality associated with asthma has been preventable based on the use of the inhaled corticosteroids. Track 1 is the preferred whenever possible, and this is the one that is recommended. However, there is a track 2, which is the traditional and the classical one that has been available even in the older versions. This is the alternative approach, where it's based on using the short-acting beta agonist as a reliever. And this is the alternative approach whenever the track 1 is not possible or it's not preferred. So really the options among track 1 and track 2 make it much feasible and practical for the treating physician dealing with asthma to choose based on the preference of patients and also on the available resources. Another point was really I consider it a smart point is the merge between step 1 and step 2 to really highlight the use of inhaled corticosteroids and the long-acting beta agonist, like formoterol, along the different severity aspects of asthma. In the milder forms, or step 1 and 2, it's been used like a symptom-driven, while in the severe form, it will be used mostly as a maintenance. And this again highlights the concept that has been used to reduce the severe exacerbations of asthma.
So it's really important work, obviously. Just going forward, this is all about GINA 2021, but going forward, what do you consider to be an area of further improvement if we look at GINA beyond this year?
Again, excellent point. The concept of precision-based medicine has been really adopted by GINA, and now we are in the era of targeted therapy and the different biologics that's been available in the field of asthma, in particular for severe asthma. GINA has already adopted and addressed the phenotypic assessment for severe asthma and the concept of type 2 inflammation to be used in the right setting and choose the right biologic for the right patients. I believe there is still unmet need when it comes to the use of biologic in terms of identifying a response-based algorithm, a biomarker-based assessment, clarifying the switching criteria between the different biologic. Nowadays, many physicians dealing with asthma, especially severe asthma, are really looking into a different biologic with different response. So we are really in need for some concept standardizing the switching criteria among these different biologics. And in the same concept, if we apply the phenotypic assessment to an early onset or a milder forms of asthma, that's really also an unmet need. And whether we need this phenotypic assessment for patients at a milder form of asthma. And that's again also bring the issue of really defining mild asthma. I think that the last point that I would like to highlight is that we are lacking an evidence for disease or modification concept or a strategy across the different severity of asthma.
I mean, what strikes me about GINA 2021 is there is a huge amount of novel information provided. So I guess the question then is, how do you make sure that that novel information is then implemented in real life? How do you make sure clinicians do the best for their patients?
Well, David, all of these novel information is based on scientific evidence, and that's what gives a high reliability and really that GINA is also highly respectful among different clinicians and also authorities. We know that GINA is not a guideline, it's a global-based strategy approach. And that's what makes it even easier to be adaptable or tailored to a different health system, taking into consideration the different or the wide variation among different health systems. In my mind, I think the implementation of GINA 2021 comes through a collaborative work. And this collaborative work includes, health advocates, clinicians, educators, NGOs, physicians, and also decision makers. They have to work together to increase awareness when it comes to asthma care and also try and change the practice to the best outcome. Once we reach this stage, I think the good health outcome will be reflected ultimately from a morbidity and a mortality aspect, and we can see it among our patients. So hopefully this implementation is ongoing, and it's a task that most of us, clinicians in the clinic are taking this responsibility and will try to incorporate it, to reach the best outcome.
I found it really interesting then you talked about coordination of care, which of course is paramount. I'm just really interested from a Middle Eastern perspective, given that you're in Kuwait. Tell me, in terms of implementing GINA 2021, what has worked for you? Is it sort of simplifying those algorithms or talking in lay language? Is it involving the patients? What's been really powerful in terms of the tools that you use?
it is now, it's very easier and it's very practical, really, both for the specialists and also the non-specialists in the clinic. We're all, relying on GINA to update our local and national guidelines and recommendation when it comes to asthma management. And, incorporating this scientific evidence make it much easier for us to incorporate this and include our patients in the decision-making. Ultimately, this will be, an evidence-based approach that we can really even talk to our patients with and talk to our physician authorities, decision makers, to help us facilitate a much better health outcome for the patient and also for the country.
Well, it's been an absolute pleasure to talk to you. Thank you very much indeed, Professor Mona Al-Ahmad.
Thank you, David. Pleasure is all mine.
Well, that's it for this edition of EUFOREA TV Breaking News. Many thanks to my guest, to Professor Mona Al-Ahmad, for her wonderful, insightful interview, delving into the detail about GINA 2021 from a Middle Eastern perspective. Now, you can find more information about EUFOREA and register for the EUFOREA meetings on the euforea.eu website, where you can also sign up to receive the latest news via email. You can also follow us on Twitter. The address is @EUFOREA. But that's it for this show. See you soon, and thank you for watching.